Level 5 Diploma in Leadership for Health and Social Care and Children and Young People's Services. Unit 1, Use and develop systems that promote communication. Who might you need to communicate with? Service users, family and friends of service users, care assistants, health professionals, managers, colleagues, social services, authorities, professional bodies, other stakeholders. Supporting effective communication. Effective communication is about exchanging information in a way that meets emotional needs and conveys the intentions behind the message. Within health and social care, it is important to maintain good communication with all service users so that they are cared for to the highest standard and so that all issues can be dealt with as soon as possible. It is also important that all staff are able to communicate well so that they can work towards the same ends and are able to discuss aspects of the role openly. Things to think about when aiming to support effective communication include the content of what you are saying, clarity, tone and pace, listening to responses and showing that you are engaged, displaying empathy, eye contact, facial expressions and posture, the environment. Common barriers and challenges include stress, environment, lack of focus, negative or inconsistent body language, attitudes, differences in perception, cultural barriers, language barriers, gender barriers, physiological barriers. Overcoming barriers of communication by using the cycle of asking questions, paraphrasing, using examples, using stories, displaying empathy, being positive, giving feedback, checking perception. Gerald Egan defines SOLAR as part of his skilled helper model to provide a structured way for counselors to improve their communication with clients. This can be used when listening to service users, helping them to feel that they are being taken seriously and are cared for by the healthcare professional. Sit squarely facing the client, preferably at a 5 o'clock position to avoid staring. Maintain an open posture at all times. Lean slightly in towards the client as appropriate. Maintain an appropriate level of eye contact with the client. Be relaxed, which will help to foster a comfortable setting in which the client can also relax. Meeting different needs. Different circumstances will require different means of communication. Some forms of communication you may use include verbal, non-verbal/interpersonal, written, visual/sign, electronic. You may be able to think of other means of communication that you use. Think about the needs of your service users. How do you meet these? Monitoring effectiveness of communication. It is important to monitor and review systems of communication so that you are able to evaluate them for effectiveness and identify areas which need improvement. Every organization will have its own ways of monitoring. One common example of a system used in the health and social care sector is CMS, Care Management System, which stores information on each service user's medical history, care plan, daily care routines, and so on, as well as allowing for communications to be made. As CMS has a read receipt feature, it can be really beneficial as it is simple to know whether a message has been received or not. Evaluating communication and proposing improvements. To evaluate the effectiveness of communication within your place of work, think about the systems and practices in place and ask yourself, what issues arise frequently? Are there concerns brought up by the service users in relation to communication? What are the positives? What changes could be or have been made to improve communication? If changes have been made, how have they improved communication? Leading implementation. Staff working in health and social care are sometimes called upon to lead the implementation of revised communication systems and practice. It is important to listen to the ideas being put forward and be open and objective about them. Use discussion to explore the ideas further and gain feedback and ensure that you have spoken to management first. Strong communication is crucial for the implementation of new systems and practice. There are a range of ways that the information can be communicated, such as through the CMS, team meetings, reports, notice board, etc. Promoting partnership working. Partnership working is about the effective and cohesive working of people, professionals, agencies and organizations with the aim of enhancing well-being of service users, as well as supporting and improving positive outcomes. These are generally long-term relationships that inform the quality of success, and share the same aims and objectives. Effectiveness of communication systems. Face-to-face, this is beneficial because you can be sure that the message you want to deliver is said to the intended receiver, and it provides opportunity for clarifications to be requested and given straight away. Using this method of communication does mean there is no record made, however, meaning that the message can be forgotten. Email, this is a good way to send long or complex information, and is useful if you want to send the same message to a large amount of people, or if you need to send documents. It also creates a solid paper trail. However, email messaging can be misunderstood, can be seen as impersonal, and can have varied response times. Telephone, this is a great way of getting information quickly to people who aren't necessarily nearby for a face-to-face meeting. It's also great for emergencies. A limitation is that calls can be missed, especially if it is a mobile contact, batteries can go flat, ringtones can be put on silent, and devices are easily lost. Social media platforms such as Twitter, Facebook and Instagram are great for connecting with a wider audience and allowing for audience interaction. However, there's no guarantee that your message will reach the intended individuals. It's also important to be careful with the content that you post online. Group, this is beneficial because it allows for discussion of ideas to take place and for everyone to hear the same information. In some group situations, however, people may find it difficult to speak up, and digressions in conversation may mean that the main message is lost. Workplace communication system or intranet, this is really good for sending organization-wide messages, especially if the system has read receipts, because you can be sure that the information has reached the right people. It's also good for storage. However, if the system crashes, it can be problematic for the organization. Legality and ethics. There are certain laws that it is important to be aware of when considering communication. These include General Data Protection Regulations, GDPR, 2018. Human Rights Act 1998. Public Interest Disclosure Act 1999. Freedom of Information Act 2000. Equality Act 2010. Confidentiality is key, especially in the health and social care sector. All healthcare professionals need to ensure that they are aware of their responsibilities to maintaining confidentiality and the relating policies and procedures. Sometimes, however, you may need to break confidentiality. Examples of when this may be necessary include: if abuse is suspected, if malpractice has occurred, if misconduct has occurred, if a crime has been committed, if you believe someone to be a danger to themselves or others. People often fear reporting or whistleblowing, which is why it should be discussed in training and outlined in a policy for all staff. Protection should be given to all staff who make reports in good faith. Information sharing. In 1997, a review panel chaired by Dame Fiona Caldicott looked at how the NHS handled patient information and set out 6 principles to be followed in protected patients and their data. In 2000, the principles were extended to cover adult social care records. A 7th principle was added in 2013 following a second review. Justify the purposes for using confidential information. Don't use personal confidential data unless it is absolutely necessary. Use the minimum necessary personal confidential data. Access to personal confidential data should be on a strict need-to-know basis. Everyone with access to personal confidential data should be aware of their responsibilities. Comply with the law. The duty to share information can be as important as the duty to protect patient confidentiality. If you would like to cite this presentation in your work, please use the citation template below.